So welcome everyone, and thank you ever so much for joining. We will get going shortly. Just a little bit of housekeeping. We are recording this event, so if you don't want your face recorded, then you're welcome to turn off your camera, or if you do want it, then do have your cameras on. You'd be very welcome to. Hopefully we'll have some time for some discussion and sharing some ideas, and so feel free to pop ideas and questions into the chat. If it's directed to anyone in particular from the panel, then do try and highlight that. Otherwise, we'll invite you to also unmute and speak in due course as well. We will try and finish at 1:15 or just a minute or two after. So it's a great pleasure to welcome you to our side event today. It's been really great seeing what's been on at the conference, and I think this complements the programme really nicely. So the order of events will be, I'm just going to give you a short presentation about the work we're doing in the UK on the topic at hand, and then I will pass over to 4 of my colleagues who've had different experiences and projects that relate to the topic, sharing their both their positives and challenges, and hopefully you as the audience will be able to share with us your own experience, challenges, or questions around what we feel is a really important topic. So I'm assuming we're likely to be talking to the converted, that this house believes that sustainable plant-based nutrition education should be a core component of all healthcare curricula. And again, just an introduction to myself and my colleagues. We're part of Plant-Based Health Professionals UK, a community interest company based out of the UK, but more and more have got international members and international projects. And we provide education and advocacy on whole food plant-based nutrition for prevention and treatment of chronic disease, as well as supporting planetary health. And in due course, I'll share our website details in the chat in case you don't know. Again, I doubt any of you need a reminder that our food system is at the centre of a number of interlinked crises. We're here because we understand that the food system is at the centre of our climate and biodiversity crisis. As healthcare professionals, we recognise that our food system and the food we eat is directly and adversely impacting our personal and community health, and unhealthy diets are now the leading cause of death and disability around the world. Within the UK and US, at least 1 in 4 deaths is caused by an unhealthy diet. And I would suggest we have a crisis of ethics, whereby we produce enough food to feed 2 planets, yet nearly 1 billion people go hungry. And on the eve of World Vegan Day, it would be remiss not to remember the nearly 80 billion land animals that are slaughtered every year, and the nearly 2 trillion fish for food. And unless we change our food system, we will not meet our climate or nature targets. This was clearly outlined in this paper in Science in 2020 that stated that even if fossil fuel emissions were eliminated immediately, emissions from the global food system alone would make it impossible to limit warming to 1.5 degrees or even realise the 2-degree target. So that is really frightening. We know a lot about what a healthy and sustainable diet will be. You will also be familiar with the Eat Lancet Planetary Health Plate, which is a predominantly plant-based diet. If you choose to eat meat, it should not be more than 1 portion of red meat a week, 2 portions of poultry, or 3 eggs. And with this type of plant-based diet, it's estimated that we could save 11 million premature deaths globally each year. And there is no conflict between what is healthy for the planet and what is healthy for us as humans. The American College of Lifestyle Medicine clearly states that a predominantly plant-based eating plan is recommended: fruits, vegetables, whole grains, beans, nuts, and seeds, a whole food plant-based diet. Whatever you choose to do in addition to it, this should be the condiment on the plate, and is certainly not necessary. So what is happening in the UK about embedding this knowledge and education into undergraduate undergraduate curriculum. Well, finally, October 2021, we have an undergraduate curriculum for nutrition, and we're waiting for that to be fully implemented. The disappointing fact for me is that plant-based or vegan or vegetarian diets are given a couple of sentences under the section of restrictive diets, and really talks about potential nutritional deficiencies. We have outcomes for graduates. This is from our General Medical Council, the regulated body, that clearly states that students should learn about the impact of diet and nutrition on health outcomes and be able to support their patients to adopt a healthy, nutritious diet. In addition, more recently, we have got a statement on education for sustainable healthcare written by Medical Schools Council. Food as medicine, they state, because a healthy diet prevents most of our chronic conditions. Benefits of a plant-based diet to health and planet, and it outlines the harmful effects of the food system, particularly that of meat consumption, the rising rates of antibiotic resistance and increasing pandemic risk, and this should be taught to medical students. So we noticed a gap in the market. This isn't being widely taught as yet. And as a group, we started back in 2018 and we launched with a conference, which was a sellout within a few weeks of launching the tickets. And there we formed our close collaboration and colleagues. Since then, we offer formal education, mainly at a postgraduate level, but also students are very welcome to take a course at the University of Winchester, fully online, globally available on plant-based nutrition. So do check that out if that's of interest. We have created, hopefully, we have created a very credible textbook to go alongside this education, just launched in September, Plant-Based Nutrition in Clinical Practice, available wherever you get your books. And during the pandemic, we transitioned our live education events to live CPD accredited webinars. Because we recognise that doctors are busy, they may not be appropriately educated and trained. We have a number of patient-facing resources that are free and downloadable from our website, and I'll share that link with you shortly in the chat. And then we'll hear from Hayley how she is teaching medical students. We're lucky in a way in the UK that 10% of the curriculum can be chosen by the students. So these are called student selected units or student selected modules. And Hayley is now offering this to 3 universities in the UK. Many of us have published peer-reviewed publications to keep this message present and relevant. And Hayley also runs a community kitchen, and we'll talk about how important it is to embed this within our communities that we work. And just to say that clearly internationally, other groups similar to ours are embedding this into education. So there's a culinary medicine program just launched at the New York University aimed at medical students. Last year, 2022, the first mandatory plant-based nutrition curriculum at Wayne State University. So lots of institutions are taking on board plant-based nutrition to teach to their students. But of course, there are barriers and challenges that hopefully will become apparent, and maybe we'll discuss some solutions. Space in the curricula, which is so full already, is a challenge. Failure of teachers, learners, and health professionals to recognise the importance of nutrition and food as medicine. The ultra specialisation, even if we do learn this at medical school, we've soon forgotten it when we become super specialised doing our membership exams. The NHS, no different from any other healthcare system, overemphasises treatment over prevention. Only 5% of our NHS budget is spent on preventative medicine. Modernising curricula take time, and clearly there's structural, systemic, personal, cultural barriers to transitioning societies over to a plant-based diet. So that's all I wanted to share with you today. And so we've got 4 individuals from our organisation, practicing healthcare professionals, to share their journey and stories about plant-based nutrition and how they've incorporated it into their knowledge base and practice. So I'll hand over to Linda Karlberg first. Thank you, Linda.
Thank you, Shireen. And thank you to everyone for being here and listening to us today. So I'll be covering the medical degree graduate perspective on the topic. So as Shireen said, my name's Linda. I'm a junior doctor working in the southeast of England at the moment, and I started medical school in Scotland in 2015 because I was passionate about how the human body works and what happens to it during illness, and I also love the people side of the job. In a 2020 study of nutrition and medical education in the UK, more than 2/3 of students reported receiving less than 2 hours of nutrition education throughout their degree. So less than 2 hours in the entire degree. And I can't confidently say just how much teaching I received, but I would say it was a similar number of hours. I remember learning about the cellular basis of metabolism and chemical pathways of hunger and weight regulation. And we had 1 or 2 talks about weight loss and restrictive diets, aligning with a mindset of less is more and everything in moderation and calories in versus calories out. And I can't remember ever being told about a specific healthy dietary pattern that would benefit humans. And we did not discuss the role of diet in the management of specific chronic diseases. And I say management because we definitely did not have a focus on preventing disease. So when we cover conditions such as diabetes or high blood pressure, there would usually be a mention of diet and exercise as part of the first line management, rapidly followed by medication. So I never attached a great deal of importance to the power of lifestyle, and I assumed that most people would end up on medication regardless. We studied to pass exams, and so we followed the curriculum, which focused on disease processes and how to treat them. So I ended up learning first, second, third, and sometimes fourth line drugs by heart. And fast forward to my 3rd year of university, when in the summer holidays, due to some personal health issues, I remember finding myself on YouTube researching healthy diets. And I ended up coming across this talk by a duo called Mastering Diabetes. I watched their entire 1-hour lecture on insulin resistance, which is a significant problem in many different metabolic diseases. And by the end of it, I was absolutely sold on trying to convert my own diet to a whole food, plant-based dietary pattern of eating, as it seemed beneficial for every chronic disease out there. I should probably mention that before that, my own doctor had put me on a very restrictive low carbohydrate diet, which led to a vicious dieting cycle. And after changing my own diet to a whole food plant-based one, I felt infinitely better. But unfortunately, I also realized I had this sense of feeling absolutely cheated, both as a patient and also as a doctor in training. This incredible realm of evidence-based medicine had been withheld from me and from my peers. So I started looking for answers elsewhere. I read Dr. Michael Greger's book, How Not to Die, which was life-changing for me, and I watched several classic documentaries such as Forks Over Knives. And luckily, I eventually came across this organization called Plant-Based Health Professionals. I started attending their webinars, which taught me so much about the power of plant-based nutrition. And in 2019, I took Dr. Kassam's online nutrition course via Winchester University that she just mentioned. And it's accredited for 30 hours, so that's 15 times more than the nutrition teaching the average medical graduate in the UK will receive during 5 years of medical school. Going into my clinical years and starting work as a junior doctor, I came face to face with disease, suffering, and death. And it's truly upsetting to think about how many of the conditions I've been trying to manage and treat that could potentially have been altogether prevented or reversed by a whole food plant-based diet. Sadly, in my experience, most doctors lack the knowledge or the tools to support patients in making lifestyle changes or do not think it would matter. Together with some peers who shared my interest, I set up a lifestyle medicine society at university, which is still running, where we put on some talks and events to educate others and highlight the power of lifestyle. And in my final year of medical school, I also started my own podcast and website called WIDLIMS, which is an acronym for What I Didn't Learn in Medical School, to spread my passion and share information in an accessible way to healthcare professionals and members of the general public who want to empower themselves. As part of my junior doctor training, I'm currently on a 4-month rotation in primary care, which has made me more aware of the barriers to preventive and lifestyle medicine. So firstly, there is the barrier of education. And I have been faced with a lot of skepticism from colleagues and from patients who are not familiar with the evidence base behind whole food plant-based diets and think it's just some sort of fad diet. It can feel isolating and tiring to advocate for something which is not the norm. And a solid background in nutrition through education would help with increasing people's confidence in advocating for plant-based diets. Secondly, some believe that nutrition is the realm of dietitians, but I believe that physicians are in an optimal position to counsel on diet as part of a holistic approach. We create and nurture these very special relationships with our patients, and in primary care, as well as other more specialized care, we have the benefit of monitoring changes and following patients up. Also, in my experience, it is basically impossible to actually refer patients to dietitians other than in very specific circumstances. So doctors should definitely learn about the powerful tool that diet can be alongside medication and surgery. Lastly, there is the barrier of putting knowledge into practice, and I wish I had been taught more about how to counsel patients on making lifestyle changes. And not all patients are in the same position to make changes, so it would be good to highlight this and ways around it as part of the medical curriculum so that we can work for and with patients to help them in implementing change rather than just lecturing at them. Luckily, I was at least taught how to interpret research and think critically, which led me to where I am today. And I hope to continue learning through peer networks and independent reading in order to be able to apply my knowledge to my clinical practice. I dream of working in a system where healthcare professionals share the same vision. I would like us to all advocate for a healthy planet, as there can be no healthy people on a dead planet. And I dream of us giving our patients guidance on how to lower their risks of contracting disease, but also guiding them if they do, with not only lifestyle medicine, but also medication and surgery where necessary. And I hope and think that most of you will share this vision with me. Thank you.
Thanks very much, Linda. That was really interesting and eye-opening to hear your very recent experience of being at medical school, and thankful that you've found us and contributing to our work. So I'm going to pass on to Laura.
You would think I would have learned by now to unmute before I speak, but thank you, Shireen, and thanks, Linda. It's so lovely to hear you talk and definitely share the same dreams as you. So my name's Laura. I'm a GP and lifestyle medicine physician, and I'm currently based in Glasgow in Scotland. I've been seeing patients for about 16 years now, but I didn't know anything about nutrition until I became interested in plant-based nutrition after my own diagnosis of thyroid cancer, which was about 6 years ago. Before I went for my surgery as part of my treatment, I had some blood work which showed that I had high cholesterol. When I started to research how to reduce my risk of cancer coming back, how to prevent new cancers, as well as how to reduce my cholesterol with diet, I discovered this vast amount of evidence for plant-based nutrition to do all these things. In my ongoing research, I started to learn how closely our food choices were connected with not just our physical health, but also with the health of the planet. And I really felt upset at the time to discover this so late in my medical career. At that time, I had completed medical school, I'd completed my GP training in the UK, and I'd also completed 4 years of exams in Toronto. And diet and planetary health were topics that were barely covered, if at all. So this might come as no surprise to people who are already aware that most medical schools offer very low hours on nutrition education. And what this means, as Linda suggested, is that only a minority of doctors feel confident about counselling their patients on nutrition. At the same time, though, most people recognise that medical practitioners should be giving nutritional advice to their patients. And so this is something that now makes up a significant proportion of my work. On a similar note, physicians have been interviewed about the climate crisis, and 80 to 90% of them agree on the reality of the climate crisis and that it's relevant to their patients' health, but most of them are reluctant to discuss this with their patients during their clinical consultations. There's lots of reasons for this, such as limited time, fear of stirring resentment even, but the most common reason for hesitating to discuss it during the consultation is actually lack of knowledge about how to approach it with their patients. So going back 6 years, I changed my diet very quickly and started following a whole food plant-based diet. And the more I learned, the more I felt compelled to share it with my patients and all the evidence I had learned. Around this time, I also became interested in and then later specialized in the discipline of lifestyle medicine. And for those who are not familiar with this, it's a new and evidence-based specialty which focuses on the prevention, treatment, and reversal of many of the common chronic diseases that we see. So these are conditions like type 2 diabetes, heart disease, and certain cancers. And lifestyle medicine practitioners help their patients by focusing on making behavior changes in relation to various pillars of health. These pillars of health are things like a whole food plant-based diet, exercise and stress management, for example. And it's really relevant when we're thinking about starting to talk about climate change, because as a practice, lifestyle medicine puts patients first. It hands over a lot of control to the patient and encourages them to take responsibility for their health. A lot of lifestyle medicine management plans actually encourage patients to adopt healthy behaviours which are aligned with planetary health, for example, following a whole food plant-based diet. But it took me really quite some time to start incorporating discussions on the climate crisis with patients. I think it felt very natural to start talking about diet in respect to their health or their disease, but talking about the climate emergency kind of felt complicated and daunting. I wasn't really sure that my patients were expecting to hear it or wanted to hear about the topic from me, and I was kind of self-conscious about discussing it with them, and also around my colleagues who didn't know much about the topic or seemed to take it that seriously. But I felt a sense of responsibility and duty. I still very much do, and that has really allowed me to overcome those original feelings of feeling daunted about discussing it. The climate change is the biggest threat to human health, and if healthcare professionals are not going to discuss it with their patients, we have to wonder who will. So now I've come to see much more clearly that it's really very relevant to a large number of clinical presentations, and it's a very valid use of our clinical time. It doesn't need to be a long discussion with our patients. It might just be a brief introduction to the topic or some signposting to useful resources. But for example, patients with chronic disease such as heart disease or type 2 diabetes should always be discussing diet and lifestyle with their physicians. And these chronic conditions take up a significant proportion of GP consultations. So they provide a really good opportunity to talk about the evidence and the health benefits of a whole food plant-based diet. And the co-benefits of planetary health can be easily fitted into this conversation. I found that many patients are motivated to make lifestyle changes if they think they're going to improve their health and help the environment at the same time, especially when it involves the same changed behaviour. So another example would be for patients who require antibiotics. Most healthcare professionals should be discussing the importance of antibiotic resistance. And a natural extension of this conversation could be how there's evidence to confirm that reducing meat can help here. So focusing on the patient's personal benefit and gain is useful and keeps it very relevant to their health. I think it's also becoming increasingly common to see people, especially young people, who are starting to feel very anxious about the climate. And in this case, I found that it's very helpful to discuss my own anxieties with them. Doctors are important role models. They're known to have a positive influence on the health of their patients. And luckily, I think we're still trusted and credible sources of information. Many people who are worried about the climate change have yet to make the connection between their dietary choices and the health of the planet. So this is a really good opportunity to raise awareness and provide education on the topic. It's often quite rewarding, actually, to be able to discuss a solution to this very large, serious problem, and to be able to give actionable steps for patients to follow to reduce their carbon footprint with changes in their diet. In all such cases, I find I'm most successful when the consideration is kept focused on the patient and their presenting problems, so what they've come to see you about, and then taking this further to find out what they value, what matters to them, and modelling the consultation around this is really key. Our messaging around the climate crisis should be focused on the patient, as I've said, and it needs to be evidence-based and non-judgmental. It's helpful to highlight that none of us are perfect and that even small actions can make a difference. But of course, not all patients are open to talk about the climate crisis during their medical consultations. Ignorance is not bliss, but educating ourselves on the climate crisis can be really quite uncomfortable and anxiety provoking. And I think, as I've mentioned, we just need to be honest with our patients about this. It can sometimes actually be quite inspiring when patients see your human side and how much you care. It can create a sense of importance on the topic, as well as a deeper connection between patient and doctor. Some patients are very surprised to hear it being brought up in their consultation, and they might resist to discussing it any further. They might not think that it's relevant, they might just not want to talk about it, or they might feel overwhelmed with other negative emotions or challenging situations. And with these patients, I think it's helpful to remember that they will eventually have future points of contact with you or your colleagues, and that you might just have planted a seed for when they hear a similar conversation elsewhere. With all patients, though, I think we need to seize every opportunity we can to discuss the climate crisis with them and highlight the connection between their health, their food choices, and the health of the planet. Thank you.
Thank you very much, Laura. It's great to hear your experience of incorporating all this knowledge that you've essentially self-taught and then gained additional postgraduate qualifications in order to be able to incorporate into your clinical practice. So thank you. So we're going to move on to Hayley, who's been working with medical students and in the community. Hayley.
Thanks very much. Thanks, Shireen. Great to hear your story, Linda, and yours, Laura. I may well cross over because obviously I'm also a GP. So I'm Hayley Tate, an NHS general practitioner in the UK. I'm based in Liverpool, England, and I joined plant-based health professionals in 2017. I've had a varied career background in orthopedics, emergency medicine, and general practice. And after 22 years of being a medical professional, I did a rare thing and I changed my practice. I'd adopted a vegan lifestyle, and as a keen cook and foodie, I embraced our new family menu without any animal products. But realizing the personal and planetary health benefits of a whole food plant-based diet was a revelation. I watched the films, read the books and the research, and connecting the dots and accepting that there was so much I'd been ignorant of, but I was enthusiastic to continue learning and share the information. I completed the certificate in plant-based nutrition run by Shireen at Winchester University, and it brought the benefits of plant-based nutrition along with other pillars of lifestyle medicine into my consultations. The idea of improving your health by changing your diet is empowering, and in addition, impacting on planetary health feels altruistic. We know behavioural change can be a challenge. However, using the theoretical models, each consultation can be patient-centred, ranging from education into the potential benefits, stimulating interest, to signposting to recipe ideas. Now, currently in the UK, general practice is under enormous pressures with staff leaving in droves, and a lifestyle consultation arguably takes longer, particularly when one doesn't have the armamentarium to discuss the evidence base of issues like nutrition, exercise, mindfulness. So whilst we know these have a huge impact on chronic disease, it's often quicker and more acceptable to offer a pharmacological solution. In an 8-minute face-to-face consultation, it's difficult to share all the information required whilst being patient-centred. And here there is a place for group consultations, educating patients on sustainable whole food plant-based diets to tackle chronic disease and live in a kinder world. I incorporate dietary questions and education to nearly all my consultations as it's so relevant. My motto is, it's only food, why not try it for 6 weeks? And I use the formula of recommending patients add in for the first 3 weeks more vegetables, fruits, spices, legumes, whole grains, nuts and seeds before removing anything that feels restrictive. It's about abundance of the good stuff, and I can provide easy recipes from my cookbook, Health on the Hub, share resources from plant-based health professionals, and signpost their free fact sheets. So sharing the benefits of planetary health by shifting to a plant-predominant diet is also persuasive. One easy change I made was putting a notice board opposite the patient chair in my room. So when I was taking blood pressure, the patient had something useful to read, and it became a focus for discussion. It's basically a list of bullet points of positive lifestyle actions. Drumming up interest with colleagues in treating diet-related disease with diet is surprisingly difficult, and barriers include reluctance to change the current practice, the challenge of learning a new approach, and changing their personal diet. It's very much akin to the smoking doctor who is now near extinction, so to the plant-based doctor eating according to the Eat Lancet Planetary Health Plate is a rare species, but hopefully on an exponential increase. I also offer Educate events, providing 2 hours of plant-based education with a free lunch that's also sponsored through plant-based health professionals. Reaching healthcare professionals before they qualify has become our best target, and our Cooking for the Climate Culinary Medicine course has been taken up as a student-selected module for second-year medical students at 3 universities in the UK. The course focuses on the sustainability aspects of what we eat and introduces principles and practical skills of a sustainable plant-based diet for personal and planetary health. The course consists of cook-alongs from my kitchen via Zoom into theirs, discussions around the scientific evidence supporting a plant-based diet, and common controversies and concerns. The participants learn how to cook simple, affordable, accessible, and delicious food, and are empowered with the confidence to incorporate a plant-based diet into their personal and clinical experience. We ran 4 courses last year, which were a popular student-selected module choice for students at Exeter and Southampton medical schools, and the feedback was very positive. They reported it to be enjoyable, fun, informative, and impactful. From post-course questionnaires, 92% felt confident or very confident in discussing plant-based diet with their patients, and 97% had learned plant-based knowledge. In terms of dietary changes, 27.5% ate more legumes, ate less meat, and 14% had reduced their dairy intake. Shireen has actively promoted the course through her university connections, and I contacted medical schools through the Planetary report card data. We have encountered barriers to incorporating the teaching in medical schools, with the main issue, as Shireen mentioned before, being time constraints in an already packed curriculum. Finding time for specific plant-based nutrition teaching is difficult. However, recognizing that nutrition is one of the approaches to treatment, along with pharmacology and surgery, is key to its inclusion in all stages of healthcare education. Recognizing the climate crisis is a health crisis and the impact our diet can have on planetary health is another relatively new approach, but one that is fast becoming adopted in many medical schools. Connecting the benefits of a whole food plant-based diet for personal planetary health is key. One area of great success is in our community kitchen, set up to tackle issues of social injustice, food poverty, food insecurity, health inequality, and feeding our homeless. Vinnie's Kitchen is a community plant-based cook school that's sponsored by Plant-Based Health Professionals UK. It teaches adults, families, and children about healthy food and how to cook affordable, accessible, delicious meals. Health inequalities and accessibility to healthy food run in parallel, and our government does little to address this huge divide between a healthy and unhealthy population. Food banks have their place, but community kitchens are a much better space to empower and educate individuals, support them in a safe environment, and provide skills as well as a hot meal. We set up in a donated space from Samson Security, and the cook school currently runs once a week. Attendees are from diverse backgrounds, but they report it's like school, but with a homely feel. They always enjoy it and want to come back. We cook a range of foods like pasta bolognese, risotto, fajitas, curry, chili, pancakes. We make bread, breakfast bars, power balls, and there's usually 50 to 70 meals to be distributed to our homeless and rough sleepers by the end of each session. Students at Vinnie's have 3 hours of plant-based nutrition teaching in a relaxed environment, learning the skills to cook an affordable, healthy meal, and this education has a ripple effect. One of the students' dads has changed completely to a plant-based diet after enjoying the meals his daughter brought home. He's reversed his type 2 diabetes and he's reduced his cholesterol. So education and knowledge are equal informed choice. And despite the accessibility of poor quality, large scale, ultra processed foods, we hope for a future where planetary and personal health will come first.
Thanks very much, Hayley. Inspiring to hear success stories coming out of a community kitchen, as you say, ripple effect, and you don't know who you're influencing as long as you're spreading the healthy eating message. Last but not least, great pleasure to welcome Declan to share his experience in a hospital.
Hello, and thank you to the previous speakers. They're all excellent talks, really informative, and couldn't agree more with what you're saying. My name's Declan. I'm a junior doctor based in Glasgow, Scotland. I've done most of my work in emergency medicine, but I'm also interested in psychiatry and lifestyle medicine. My journey into the world of plant-based diets began with environmental concerns, but this quickly led me on to researching more about the impacts, as outlined earlier, on human health and animal welfare. My interest in plant-based nutrition continued to grow, and like Dr. Laura Freeman, I ended up completing a diploma in lifestyle medicine. The more I learned about nutrition, the more I became aware of that the perceptions and food behaviours of my colleagues did not always seem to align with the most helpful choices. For example, very health conscious staff members would be consuming a lot of energy drinks, protein bars, or attending the gym each day and eating only chicken and rice, or counting calories on a diet that was extremely high in ultra processed foods. This all seemed to be in the context of a food environment that was saturated in sweets, chocolates, cakes, and this isn't to vilify any one of these particular foods, but when consumed in excess, we know can create problems. I also heard them speak about various fad diets and supplements they had tried, and this eventually inspired me to do a project focused on what food staff members perceived as healthy and whether education on up-to-date evidence altered their perception or behaviours. So I got a group of 17 staff members from my emergency department at the University Hospital Ayr in the west of Scotland. And they filled in a survey at the beginning and end of the project on questions relating to their dietary perception and behaviours and their food environment. They had 3 educational sessions centred on whole food plant-based diets, gut health, well-being and macro micronutrients. The group also did the Blue Poop Challenge to measure their gut transit times, and they got to try plenty of plant-based foods, which added to the level of engagement of the project. The results of the final survey were really interesting. 100% of staff reported changing how they thought about food. 93% made a change to their diet. At the beginning of the project, 65% reported being aware of how food relates to chronic disease, compared to 100% at the end. Similarly, 53% of participants were aware about how their mental health relates to diet, and this rose to 100% by the end. Participants reported a significant change in perception around the healthfulness of certain foods, particularly fibre, carbohydrates, and dietary plant diversity. And interestingly, 100% of participants reported sharing what they had learned with someone close to them, and 30% of them shared what they had learned with a patient. Anecdotally, though, some participants told me that they'd stopped eating red or processed meats. Others had increased their plant diversity. All participants reported feeling generally better in themselves. And one participant had told me how their menopausal symptoms had improved drastically since adopting a more plant predominant diet. In general, overall, the engagement was amazing. Staff members would talk to one another about changes they've made, and they'd talk about new and old plant-based foods they've tried, and shared various nutrition resources like podcasts, books, articles, and recipes with one another, highlighting the importance of shared community when doing something like this. This spread to other people in the department and generated a lot of conversation. And I ended up getting approached on multiple occasions about more personalized and specific nutrition questions. Like every project, it was not without its challenges. Some staff members were scared to join as they thought it meant you'd have to go vegan or give up meat immediately, reflecting the wariness that some people can have around plant-based diets. Some were extremely open to the idea of adopting a plant-based diet, but didn't feel they had enough time to research it, knowledge or know-how on how to implement it. Some found it difficult as they just ate whatever food they had access to in their environment. Mainly, this highlighted to me how important it is to be supportive, providing support and resources in many different forms and always to remain encouraging. My plant-based journey didn't happen overnight, and it often doesn't take place perfectly. So it's important not to let perfection be the enemy of progress. In conclusion, there's a lot of misinformation and confusion around what a healthy diet looks like. Equally, there's a large appetite from healthcare professionals who want to be more informed on up-to-date nutrition evidence for both personal and professional reasons. This project showed on a small scale how effective education can be and what it could look like. And this was all done in a busy emergency department over a 4-week period. Imagine what could be achieved over 5 years in medical school. So, thank you very much.
Thank you, Declan. That was an excellent way to end our presentation and thought-provoking. So thank you, and well done for your successful project. So while you are all thinking about your questions or comments, just to summarize, I think, we as a group span more than 25 years of medical practice without giving away anyone's age here. And we've all had similar experiences of having to obtain education on nutrition and its impact on health for ourselves rather than as part of our core curricula, with many of us reaching for media and social media as means of education. But actually, once we've incorporated it into our clinical practice, patients, their families, staff members have the potential to really benefit from this knowledge and education, and it's simple changes that can really have transformative impacts. So we really invite you to pop any questions in the chat, otherwise I will have to keep talking, or unmute yourselves, raise your hand under the reactions button. You can choose to raise your hand or just unmute and start speaking if there's nobody else. I've now lost my tab here. Inviting any comments, otherwise I'm going to go around the panel. Everyone's awfully quiet. So, Linda, I wanted to ask you, as you're the most recent probably to medical practice, whether you find your colleagues at the stage of your career are at all interested in their patients' diet and nutrition, whether it's even asked about in consultations.
Do you mean colleagues that are like my age or people that I'm working with?
Either, really.
So I wouldn't say that there was, I'd say definitely, there were the few peers in medical school that we formed the society with. And so I think there were some people that were interested. And as I went through medical school, a few more kind of vegans popped up that went vegan for health reasons. But I wouldn't say there was a massive interest. And now I'm in a GP surgery. I'm disappointed in how few people seem to be interested in lifestyle medicine or know what it is. I think the main person that seems to be interested in diet and health is one of the nurses, and she does a lot of consultations with patients about their diet and diabetes. And so I'm actually doing a small project to see if patients that get a new diagnosis of type 2 diabetes get counselled on diet. Just like a yes or no question, do they get any, is it mentioned when they're told about their diagnosis? And most people do. Then I've looked a bit more into what the advice is, and it's to restrict their calories and to go low carb. So quite disappointing. And I am going to present my findings to like in an afternoon to some of the other practitioners, and obviously I'll be giving a bit of my take on what a healthy diet is. But yeah, there's definitely lack of interest, I think, and it goes back a lot to what Laura says about people being quite stressed, and it's a very big practice and they're just trying to get through the day and see all the patients, and yeah, sadly, no, it's not that much interest.
No, well, as you say, not surprised to hear. So, Dawn, you've asked, as a nursing instructor in the United States, you recognise the importance of plant-based diet. So wonderful to hear that. And do any of us know what's being done in nursing programmes in the UK? I mean, from my personal experience, I haven't got any inside knowledge other than to know that it's, well, other than my feeling that it's probably very dependent on the tutors and the staff that you've got in the nursing school. So we have within our plant-based health professionals group nursing educators that incorporate that into their lectures, but I don't think this is uniform. I'll put that out to the other panelists. We're rather doctor heavy today. Anyone know of any sort of nursing programs or of incorporating diet and nutrition education, particularly plant-based? No, I mean, I think our experience really is really CPD events that take place in the community or in hospitals that sort of cover these topics, but it's certainly not necessarily plant-based focused. And in the UK, certainly there's quite a lot of education on the low carb approach for weight loss and type 2 diabetes. So, and not much focus on plant-based as a kind of therapeutic option. I think it's much more talked about in circles who are concerned about sustainability rather than health per se. But Laura, just asking to you really, I mean, what do you think are the main factors that help your patients to sort of stick to the type of advice and counselling and guidance that you're giving them?
I think that can be really variable from patient to patient, depending a lot on maybe their diagnoses or what they're presenting with or how motivated they are to make changes. But ultimately, I think it comes down to the support that they have from friends or family or wider communities to make the changes, which are usually begin with dietary changes when I speak to them. And maybe how many changes or how much change they have to make. So typically, if you can make it kind of easy and relevant to them, then it's usually something that they can stick to and make it sustainable for them. But there's usually always some challenges along the way. So if they have support along that journey, that's usually a helpful thing.
Yeah, that's really interesting to hear, and certainly Declan's experience of social support and having group that are all making those same changes and sharing experience makes a lot of sense. And for you, Hayley, in your community kitchen, you're teaching, you know, school students all the way through to, you know, Lifestyle Medicine Society medical students. Is there any shared learning between those groups, or are their interests very different?
No, I'd say they're pretty much identical. I mean, we all start the session around the table with all the ingredients on, and we dive in and discuss the different ingredients and taste the spices. And, you know, I discuss all the benefits of the different ingredients. And yeah, I'd say it's pretty across the board with we always use, you know, fibre as the F word in the kitchen. And yeah, it's always well received, and we discuss as they're cooking as well, all the different benefits of the plants and the spices, and everyone's really enthusiastic, seems to have fun. They all want to come back. You know, as you say, we've had the lifestyle medical students group, which probably you were part of, Linda, but this is the Liverpool group, and they've been along. And then, you know, we've got families from deprived backgrounds, people involved in traumas, mental health illness, but it's just a light atmosphere, but an atmosphere of learning and education, which is great.
Yeah, and the one thing you're excellent at is really keeping your food costs low. So I mean, when you have costed up a meal that's being cooked in your kitchen, how much does it cost roughly?
So we were getting like soup starters, things under 50 pence, and definitely a main meal, you know, a calorific main meal under £1.
That's really impressive, because another prevalent myth, isn't it, that, you know, you transition to plant-based and it's definitely going to be more expensive, but with a little bit of knowledge and skills, you really can, you know, keep the cost low. Although clearly we are entering a period of fuel poverty and people are not wanting to use stoves and electricity and things, and that's going to really hamper our abilities to make and cook up plant-based meals. And we have to do a session on microwave cooking or something.
Well, we've got the fuelless slow cooker, haven't we?
Yeah, that's true.
There's a fuelless slow cooker.
Yeah. do pop your hands up if anyone wants to say anything. Otherwise, I will end by coming around to Declan and, you know, just addressing that sort of disconnect between hospital food and what you were trying to empower your staff colleagues to do and change and transform their diets. I mean, I'm only making assumptions about the hospital food and Ayrshire, but was it easy to be able to go to the staff canteen and buy a meal that's that you were advising your staff to adopt?
Well, I must say, in fairness to Ayr Hospital, they do have vegan options, but in terms of a kind of nutritious, whole food, plant-based option, I think it leaves a lot to be desired. And interestingly, in my survey, I asked the question as to whether staff members thought that the food at the hospital and being served to patients was healthy. And I think it was like 70% of respondents said that they didn't believe that the food was healthy that we served to patients or to staff. When we gave staff, we gave staff butter bowls and stuff like that, who were part of the project, and they absolutely loved it. And they were like, can this please become part of, you know, like just on the menu at the canteen? And there's been some spin-off from this, and I've chatted with the wellbeing team at NHS Ayrshire and Arran, and they've been really receptive, very open to kind of plant-based nutrition, and they have kind of asked to do further talks, including with Laura, who's done a talk for them, I believe. And they're also going to try to get more plant-based food into the canteen, and they were talking about maybe doing a plant-based day. So yeah, they certainly are open to it. And I think they are aware that the food can be improved. But when I had discussed it with canteen managers and other staff members, they had told me that feeding a patient breakfast, lunch and dinner costs them £2.50. So if we can find, you know, nutritious meals and change, you know, the menu that will cost them the same as that, then by all means go for it. So yeah, the hospitals aren't without challenge either. They're also trying to do their best.
Yeah, thank you, Declan. I think that's a shared experience with myself at King's College Hospital. Finance is the main driver, you know, reducing food waste, so trying new things and risking an increase in food waste is a challenge. And when we have had meat-free days or removed beef from the menu, then you know, people either choose to eat outside of the hospital and aren't using the canteen, which brings down the takings for that day, or instead of beef, they're more likely to choose chicken rather than try the plant-based option. So certainly at King's, we need a lot more sort of staff education and awareness, and a bit more of the nudging technique to get people to change or try new things. And I think, you know, cost is a barrier there. If you're going to choose something, try something new, you may not want to, you know, risk £5-7, which is kind of what it costs in the hospital canteen for us. So yeah, things to think about. Well, I have popped in the chat various links to our shared website, to the short course at the University of Winchester, our fact sheets, Linda's podcast, Hayley's book, and then our organisational email if anyone wants to reach out to any of the team and hear more about some of the projects we presented today. If there's any shared learning, we'd be really happy to collaborate with you all. And most of our resources on the website are free, and our live webinars are free also, and hopefully in due course go back to some live conferencing as well, so hopefully get to meet you all in person in due course. So I'll thank everyone for joining, especially our panelists for sharing their expertise, knowledge and experience with us tonight, for all of you for spending Halloween, well, if you're in the UK anyway, it's the evening. If you're joining from America, then it's still your daytime, and wishing you all a very happy World Vegan Day tomorrow. So thanks everyone.